Okay, to discontinue an IV, you would check the medical order for it, and then you would gather your supplies, which would be adhesive tape remover, some tape, a 2x2 gauze, and a sterile alcohol prep pad. And then you would identify your patient by their wristband and asking them to state their name and date of birth. And then you would wash your hands, and you would detach any IV pump or IV hanged fluid, and you would observe the amount that's left in the bag and what solution that they were receiving. I'm just going to go ahead and disconnect that. Okay, and then after you do that, you can put on some gloves. Okay, and then I'm going to go ahead and get some tape. Where is it? And before you move it, you would state why you're removing the IV. Okay, so then you would start by pulling from the edges and making sure the catheter is stable in its place as you're removing it. It's stuck on there. You would bring everything to the center. I really take that down. Okay, then you would get your 2x2 gauze ready, and then do it with the hand, and then you would slide the catheter out. Apply pressure. As you're applying pressure, you want to look at the tip of the catheter to make sure that it's intact and that it's not frayed. You would dispose of the catheter, and then you would want to look at your insertion site and make sure that it's not infected, it's not inflamed, bleeding, red, swollen. And then put a piece of tape. And then you would want to discard everything and put your patient in a comfortable position. You would want to take everything out of the room, the IV stuff, and then you would want to document the catheter tip, how the catheter tip looked. You would want to document how your insertion site looked, how much fluid the patient received, what kind of fluid the patient had, and how your patient tolerated having the catheter removed, and your initial time, date, and I think that is it. And then you would wash your hands before you leave. That is all.